Okay. Sarah Avery is a doctor of physical therapy, professional yoga therapist, a yoga teacher, and an entrepreneur. She has seen firsthand the ravages of lymphedema through the experiences of a close family relative. 10% of profits from her company, Moon Cycle Seed Company, benefit the Omentum Project. Sarah's favorite activities are yoga and dancing whenever possible, being with family and our dog, and traveling.
Good morning. My name is Sarah Avery. I'm a doctor of physical therapy, a professional yoga therapist, which allows me to incorporate yoga as medicine into physical therapy and healthcare. And I am a 200-hour registered yoga teacher. Along the same time that I was developing a side business called Moon Cycle Seed Company, which is a company that uses seed cycling as a naturopathic protocol to establishing hormone balance in women's health. Along that same time, I had been introduced to Meg, who was developing the Omentum Project, and we had a lot to offer each other. So she has invited me to discuss energizing lymph flow from the lens of a physical therapist and a professional yoga therapist. So I know that exercise has already been discussed in terms of lymphedema. So there are 3 areas that are within my expertise and scope of practice that I wanted to discuss with you today. So using yoga to help stimulate lymph flow is a very nice tool regardless, and it's relatively low risk as well. So 2 particular movements that I enjoy for moving lymph is twisting and inversions. So twisting is not only good for the internal organs to stimulate and to move blood flow and lymph flow as those 2 work together, but twisting also helps to move fascia that lies between all of the organs, the skin, the muscles, and that's important because our fascia houses a lot of blood and lymph vessels as well as nerves. So especially after surgery, in the abdominal region, that's going to be important to move the fascia, let it breathe, let new blood flow and nutrition come into those areas. So when we twist, we're essentially stretching those tissues that might not get an opportunity to stretch very often. So we're opening up and allowing new hydration to come into those spaces and allowing the lymphatic fluid to be returned to the heart and be dispersed throughout the systems. Likewise, inversions are really great to incorporate into a yoga routine, just because lymphatic fluid is gravity dependent, meaning if you're having swelling anywhere, it's going to go downward. So we want to oppose that by getting essentially upside down or encouraging blood flow to the heart. So the body and the natural pumps in the body don't have to work as hard to get that fluid back up and into circulation. Moving on to walking. So walking is so critical and so important for venous return of lymphatic fluid. More importantly, and this usually is most helpful when lymphatic fluid is collecting in the lower extremities, but still useful when it's incorporated for lymphatic fluid that's accumulating in other parts of the body. So walking, the reason why this is important is because your calf muscles act as a pump to squeeze that fluid back up into circulation, creating a pump and allowing that fluid to flow throughout the body. In addition, you're increasing your heart rate. So that's your body's overall natural pump. So you want to stimulate that as well, increasing the heart rate so that you're allowing those fluids to flow freely. Finally, aquatic therapy can be useful in physical therapy or in any other type of therapy regarding lymphedema. The reason for this is water has these properties where they create a pressure around the body when they're submerged in the water. And that helps to move lymphatic fluid. So if you're squeezing a balloon or a water balloon, and you will notice that that water shifts into places that are around the areas of compression. So that's similar to what's happening when you submerge areas of the body that are filled with lymphatic fluid. So you're creating this circulation of fluid. So manual therapy is another tool that we use in physical therapy practice to help energize lymph flow. So these types of massages are typically called a fluid flush massage, where we're flushing out the fluid out of the extremity or the affected body region. There's certain things to consider when using manual therapy for lymphatic drainage. And we want to be in a gravity-dependent position to improve the circulation of the fluid to the heart. So like we discussed before, where the calf muscles act as a pump, and that's because gravity is directly related to where that lymphatic fluid will go. So we want to be in a position where the legs or the extremity are above the area of the heart, so that that lymph fluid is using gravity, and then gravity is on its team to help get that fluid back into circulation. So in terms of the abdomen, after an omentectomy, you would want the hips to be elevated on a table and maybe the feet up on the wall. And that's just going to help to stimulate that lymphatic fluid even more. Two terms here that we need to go over. So proximal means closest to the heart or closest to the midline, and distal means in the extremities or away from the midline. So we want to clear that fluid proximal to the heart first. So meaning we would want to work in the area in the abdomen that's closest to the heart. And then we want to work distally, so away from the heart and then back up. So basically what we're doing here is clearing the areas above so that the areas below can be moved upward. So it's kind of like a tube of toothpaste. If you have a clog up at the top of the tube, you won't be able to squeeze that fluid up or the toothpaste up as quickly as you could if you started from the top and worked your way down and back up. With lymphedema or any fluid flush massage really with swelling or anything like that, you want to utilize light pressure. And that's because your lymph nodes are very superficial, so they're close to the skin. So if you're applying a really heavy pressure, then it can actually occlude the flow of the lymphatic tissue or of the lymphatic fluid. So we want to use light pressure there. There are some benefits that manual therapy can be used in lymphatic drainage. So we're improving digestion. The patient might experience less bloating, less discomfort, and improved GI health. So there's a couple of other things regarding that in terms of nutrition and low salt that I know are being discussed by somebody that is more of an expert in that world. So kinesio tape can be wonderful if used in the right way. So kinesio tape is a type of tape that almost mimics the properties of our skin. So if you have ever looked at a piece of kinesio tape, you'll see that the fibers are woven. So not only are the fibers able to move in a parallel fashion, but also in a diagonal fashion. So we're kind of creating this network, this microscopic network of support for the skin. Another way that kinesio tape is being used is you're essentially laying down the tape on top of the skin, and because of the properties of the tape and the mimicking of the skin, it's going to lift the skin up ever so gently away from the underlying tissues. So again, talking about fascia here, so we're essentially creating more space in the fascia, and that helps to dilate the blood vessels, so the veins and the arteries, and also it helps to dilate the lymphatic vessel so that you get a little bit more of the lymphatic return back to the heart. So in the case of an omentectomy, and I was able to talk to Meg a little bit more about this, but she was putting the tape in a kind of a crescent moon shape across the abdomen just underneath the ribs. And that seemed to help with some of the discomfort that she was having relative to bloating. The tape itself can be stretched to a certain degree. So when it's on the paper backing, as you can see in that picture there, it's already at a 25% stretch. So when you just lay it on top, you're at a 25% stretch. So if you are stretching it to 100% stretch, meaning you can't pull it anymore, that can create a little bit of compression on the skin, so we don't want to necessarily overstretch it in this case. So we just want to create a gentle lift of the skin. So here's a photo demonstrating the application of kinesio tape. There are many applications, but this one has seemed to be helpful following omentectomy. It helps to alleviate pain, and again, it can help improve circulation, and it provides a gentle lymphatic drainage when applied with a 25% stretch. Although there are many other ways that you can energize lymph flow, especially if you see a lymphedema specialist who is certified and credentialed in treatment of lymphedema. These are simple ways that I have found that really work with my patients that do have lymphedema to help improve their quality of life, their comfort, their digestion, and their overall sense of just feeling more comfortable. So just to recap, that is exercise. So prescribing yoga therapy as medicine or using walking as a program to help improve circulation, or to use aquatic therapy to help stimulate and create external compression to improve the circulation of lymph fluid, or a combination of the three. I find that those are very they're not only therapeutic but easy to do, they're fun to do, and depending on what the person enjoys doing, at least one of those types of therapeutic exercise can be integrated into a daily practice. Also, the kinesio tape is a relatively simple way to energize lymph flow at home. So the patient is able to apply the tape to themselves after they've been shown how to properly apply the tape. And finally, using manual therapy as a way to return lymph flow back to the heart can be useful. It can be done anytime throughout the day, especially at the end of the day where you have been in a gravity-dependent position, walking around all day, sitting upright, so fluid might accumulate more in the abdomen. So at night we would want to lay down, get the hips elevated, and do a fluid flush massage properly for about 10 to 15 minutes. So all three of those protocols can really help to, again, improve patient quality of life and just general comfort after omentectomy. So I wish that I could be here in person to answer any questions that you might have, but I'm more than happy to be in touch with any of you if you do have any questions. I've included my email and my work phone number there. My office is located in Saratoga Springs, New York, and so I am local. And if you are looking for any information on medical therapeutic yoga and what that is, I have included the link to that information in this slide. And if you just want to pass along any questions onto Megan, she can relay them to me. I'm happy to do that as well. And I just wanted to thank you for supporting the Omentum Project. It's something that I'm so proud and happy to be a part of. And Meg, thank you so much. And I hope you all have a wonderful day.